My name is Giang Nguyen, student ID 32086582. Today I would like to describe the normal delivery mechanisms. So firstly, before we go into detail, I would like to mention about some medical terminologies as well as some landmarks that we will use during this video. So firstly, regarding the mount, we know that the birth canal is a curved canal made from the pelvic bones and the pelvic floor muscles. So the inlet of the birth canal will be the pelvic rim. The pelvic rim is a clear bone line that separates the upper flap of the iliac fossa, also known as the fons pelvis, and the lower part of the pelvic, which is a real pelvic part of the birth canal. And the outlet, so that's we mean here, this one here. And the outlet of the birth canal is made from the lower border of the symphysis pubis in the front and the middle lower border of the sacrum and the coccyx in the back. The largest or the widest diameters of the inlet and outlet are the transverse for the inlet and the anterior-posterior diameters for the outlet respectively. Regarding for the baby, to mention the positions with the baby and the uterus of the mom or the lower point of the uterus of the mom, they use these terminologies. Light. Number one is line that mention the relationship between the long axis of the baby, is the backbone of the baby, and the long axis of the mom or the backbone of the mom. The second is the presentation, that means the part of the baby will go into the pelvic rim. The attitudes, that means the relationship between the head of the baby and its limbs of the baby. The denominators is the name of the key point of the baby. Presenting is the pelvic floor, and the positions is the relationship between the denominator of the baby to the landmark to the landmark of the pelvic floor of the mom. So in the normal delivery, the positions, the light, the baby will be goes with longitudinal. That means the backbone of the baby is parallel with the backbone of the mom. The presentation will be the head of the baby. We call it the cephalic. And the attitude will be a good or well flexions. That means the baby will bend the neck very well. And the denominators in this case, we call it occiput. The positions in the normal labors can be the left or the right occiput anterior positions. In this video, I will describe the position of the left occipital anterior position. We know that in the skirt of the baby, it is divided into four parts. The first ones we call it the face. The second we call it the brow, also known as sinciput. And we have the vertex, and then we have the occiput. On the skirt of the baby, we will have two fontanelles. The anterior fontanelles named pragma, and the posterior fontanelles named lambda. The shooters connect between the anterior and the posterior fontanelle. We call it sagittal shooter. In the skirt of the baby, the smallest diameter is the subocciput, pragmatic diameter with 9.5 centimeters. To successfully deliver in labor, the baby have to move passively through the birth canal, go into the inlet and successfully moving and rotate slightly through the birth canal and go out. Will move through go out with the outlet of the birth canal under the contractions of the uterus. To do that, the baby have to slightly turn to take advantage of the widest diameter of its part of the birth canal. These movements include desions, flexion, internal rotations, rounding and head extension, restitutions, internal rotation of the shoulders, and external rotation of head, and then lateral flexions. With the desions, the baby will enter to the inlet of the pelvic floor. That means the pelvic rim with the positions lie longitudinal, and the head will go inside. And this time, the sagittal sutures will take the transverse diameters of the pelvic rims. So that means the baby will take the widest diameters of the pelvic rim. And the presenting to these times will be the occiput and the frontal diameter, this is natus diameter. Flexions. Under the contractions of the uterus, the pressures from the fundus of the uterus push downward along the backbone of the baby, go to the occiput and the sinciput. However, because the sinciput is nearest the backbone to compare with the occiput near the backbone to compare with the sinciput, so the occiput will push downward more than the sinciput and then increasing the flexions. That means the baby will bend the neck. So it will turn like that. So now the diameters of the babies presenting by the subocciput, pragmatic diameter. That means the smallest diameters of the baby, 9.5. Syndolitic part of the baby with the pelvic floor. Due to the resistance of the muscles and the lateral shaft of the pelvic floor, it makes the baby slightly rotate 1/8 toward. So now, the sagittal sutures of the baby is on the oblique diameters of the pelvic. We call it the internal rotations. The furthest going downward, the head of the baby will turn a little bit more to take the anterior posterior diameters of the pelvis, which means the largest diameters of the outlet of the birth canal. However, the trunk no longer rotates, so it makes the head and the trunk of the baby slightly twist a little bit. Since the occiput slides beneath the subpubic arch, and the head is no longer retract between two contractions. That means the rounding state. And then, under the pressures, the extensions of the head start. It will be with the sinciput, the face, and the twins swept out of the perineum of the mom, and then the head is birth. With the head is birth, the head will be, after the head's birth, the head will be slightly rotate backward to make the head and the body align correctly. So we call this is reinstitutions. And then, since the shoulders reach the pelvic floor again, under the resistance of the muscles and its lateral shaft, it makes the internal rotations of the shoulder. To make the shoulders, put under the anterior posterior diameters of the outlet. Okay, and so these times the occiput will be opposite with one side of the mum, while the face will turn to against the other side of the mum. Since the anterior shoulder slide beneath the subpubic arc, the posterior shoulder will slightly move out, and then the trunk is borne bilateral flexions. That means the backbone of the baby will span sides away through the curve of the birth canal. Okay, and then the trunk, the legs of the babies is born. The labor is a cephaly. Thank you.